From Henry Ford Jackson Hospital, Emergency Services Physician, Dr. Alan Lazzara. Morning, Alan.
Hey guys, how are you?
Good, how are you doing?
Good to see you again.
We're just back from a big golf tournament, so we do have a little bit of shin splints, which
Okay.
I'm sure you would expect.
A lot of walking.
Yeah, and I've got a little lower back pain.
I heard. Yeah,
So
happens to
it
a lot of
does-
people.
Yeah, it happens. So back pain's one of those things that if you have it, people say it's the worst thing in the world. But what do you do if you have back pain? How do you know if it's severe enough to go see you?
Sure. Yeah, I would say if I had to put together a top 3, chest pain, belly pain, and back pain, what we see in the ER would definitely be in the top 3 for sure.
Really?
Oh yeah.
Surprising.
So we see a lot of people who struggle with chronic pain in general, but back pain is probably of the most common outside of knee and hip pain. What do you do? I mean, following up with your regular doctor and talking to them about it early on is, I think, really important because it's if, as anybody knows, it's a long haul. You know, it can take months, if not years, to get better and rectified. But you know, when we see people who come in with that, we assess their past medical history with the back pain, like the instances around when it happens, how it happened. You know, of course, if there's a trauma or a fall, then we're more likely to do some imaging. And I think there's a lot of mystery about why we don't do imaging or what kind of imaging we do or why don't I get an MRI. And I think that's part of why we're doing these episodes to help educate people so why we do what when. So
Everyone at some point has it. 80%, I saw somewhere, 80% of people have experienced back pain.
yeah, I've been there. I grew up in the Midwest, so I shoveled snow, and at the end of my residency I was treated to like a little disc bulge that took 6 months to get better, and it was very painful. When I sneezed, I had to hold onto the wall, and I used to wrestle in college, and I had a back injury then, and it'll put you out for a long time. But the way we generally handle it, so somebody comes in, take a good history, and we look for something called red flags. Red flags are really worrisome symptoms, like somebody who has numbness in an area where you ride the horse, kind of the saddle area between your thighs. Somebody who has trouble going to the bathroom, pooping or peeing. Somebody who has weakness in the legs certainly is indicative of, this is all indicative of something pressing hard on the spinal cord in the lower back. And when that happens, we see certain physical exam findings, like different kinds of changes in the reflexes, different changes in the strength. And it usually follows a pretty stepwise pattern. Somebody will come in, they have bad pain, I've had bad pain for a couple months, now my right foot is numb, and now I can't really lift my foot up when I walk, I'm tripping. And people really only end up getting an MRI when they have those latter symptoms, like the weakness. That suggests that it's pressed so hard, gone so far that now they may need surgery. And that's really why we do MRIs, is to help for surgical planning and to know whether or not somebody needs a procedure done emergently. Therefore, that's the minority of patients that come in. Therefore, that's the minority of patients that get MRIs because they take a very long time to do, a long time to schedule by our standards. We're like, Minutemen, we want something done now. And so MRIs look at the soft tissue. They look at the spinal cord and the discs in between the bones. So the way I like to describe it, and one of my, Nick Dyke, right, one of my partners, he actually bought a model or a number of models for the department so we can bring them to the room and say, like, this is where your problem most likely is. It's a spinal column with the bones and the discs and the spinal cord, so we can show people, because it's kind of hard to describe these nebulous things. But so these discs can bulge out as you age. The discs, which are made of cartilage or a type of cartilage, can get more, I describe them more jello-y, and they can squeeze out right, left, or center. If it squeezes out like on the right or left side, it's called a radiculopathy, or also known as sciatica. When people have that pain going on the back of their leg. When it's in the middle, that central canal stenosis pushing on the spinal cord can really cause some bad problems for people beyond just pain, which most of the time people are there for pain control, which we're adept at, but it's hard to do, long term.
It's different for everybody too.
For sure.
I have a friend who, maybe once a month he won't be able to get out of bed.
Yeah.
But then the next day he's out golfing. So it's just certain things. we really need to make sure we take care of our whole body, correct?
sure.
I mean, because
Yeah.
if we're not taking care of our lower extremities, especially, we put some strain on our back, I bet.
Yeah, from walking upright, it
Yeah.
definitely puts a kink in, you know, your anatomy. So we're bearing all the weight of gravity, even though we don't really feel it all the time. Your body is still subject to gravity all the time. And people who struggle with being overweight, or people who've had prior injuries, or, you know, roofers, or people who have super physical jobs like concrete guys and people like that, really, you know, their back takes a bad beating, especially from all the bending over. Like my grandpa was a carpenter, and his back is kind of like a C shape now.
Right.
And, you know, that's just the way it is for him. But the way we treat, so the way we work it up is very stepwise. So somebody comes in, they've had a bad trauma, they're going to get a CAT scan to look at the bones, and if there's something concerning about their exam, then they might end up getting an MRI. We don't really use x-rays. X-rays are not very helpful. They miss about 40% of compression fractures.
Really?
Yeah, so they're pretty, they're not useless, but they're very low sensitivity and specificity for what we want to look for. You know, and then a lot of it is based on the history. You know, if we have somebody who's been, you know, they're a 60-year-old guy who's been losing weight and having night sweats, and he's got lower back pain, I'm worried about prostate cancer or something that going to his spine, so I'll do a CT. But a lot of times, CTs are really only used for trauma, and a lot of times we don't need imaging because they've had outpatient imaging. We know they have degenerative disc disease. We know they've been in this wheelhouse for a long time, and then it focuses more on how can we get you to have less pain and be more functional. So we help coordinate people with their primary care doctor, with our pain management clinic, come up with a good pain regimen, spend a lot of time talking about this medication's for this is for this is for this. Please take the Tylenol. I know you say it doesn't do much, but it's part of the whole pyramid of pain control. And then steroids are sometimes indicated to help reduce the size of those discs or the swelling or inflammation that's there.
I think a lot of people don't think there's any help for them. They sleep
Right.
on plywood, or they buy the Tylenol
Yeah.
patches, or they, you know, it's just, they live with it.
Yeah, and you know, some people, you know, I've heard people talk about chronic pain a lot, and some chronic pain never goes away, and that's the way it is for that person, unfortunately. But it doesn't mean we can't do anything about it. People learn how to live with that pain, but they also are able to mitigate that pain with medications, injections, and eventually surgery is kind of a last resort. I'm a big believer. I have an immense amount of respect for all of our surgeons because they do amazing things, but I never want to have a surgery if I don't absolutely need it. So we really, you know, we take the time to do this in a very graduated fashion so that people aren't getting surgeries for back pain that might get better, you know, in 3 months to 6 months. And we know that, you know, it takes about a month for back pain to get better. Most people will get better by a month, and it's hard to say that to a patient and say, you should be better in about a month. But, you know, I also say, you know, like, look, I've had this, it took 6 months, and it's brutal. But you got to stay active, you know, laying on the couch will make it worse.
Right.
Going for walks will make it better, you know, for most patients.
Well, we always appreciate your knowledge and advice. Thanks for coming in today.
Yeah, my pleasure.
Thanks, Todd.
All right.
Dr. Alan Lazzara from the emergency department at Henry Ford Jackson Hospital. More of the morning show right after this.